Oh my God, I have this nasty pimple on my eyelid. What's going on? Welcome back, Pupil Gang. My name is Dr. Seymour. I am a board certified optometrist, and on this channel you'll find everything related to beauty, lifestyle, motherhood, and eyes. So I haven't done one of these in a while. I miss you guys. I miss, talking about different eye conditions, things related to eyes, but it's been kind of hard. We're still in quarantine. My son is out of daycare, so trying to film while he's at home has been difficult. So I am doing what I can. If you see him run through the video, I'm sorry. It's just how it is, But yes, so I'm still at work, but I still wanted to come on here and discuss some things with you as far as relating to having a stye. So let's get into it. So as a disclaimer, this is just for educational purposes only. I highly recommend, if you do have any of the signs or symptoms that I'm going over in this video to see an eye care professional. So what is a stye? So the medical term for it is actually called a hordeolum, and there's actually two types, and we'll get into that later on in this video. But usually it's due to an infection as far as bacteria, either on the base of your eyelashes or inside one of your eyelid glands. So usually it's a tender red bump that is filled with pus, inflammation, bacteria. So that's what makes it appear to be sort of like a pimple on your eye. So usually the bacteria is often caused by a bacteria called Staphylococcus aureus. So who's at risk to get a stye? So if you had one before, if you don't practice good contact lens hygiene, as far as not washing your hands, sleeping in your contact lenses, overwearing your contact lenses, swimming, showering in your contact lenses. So a lot of people are like, oh, you can't swim or you can't shower. No, it's not recommended, because a lot of times in water there's bacteria, viruses, parasites. So if it gets stuck between the contact lens in your eye, can cause an infection. Some other culprits will be also reusing contact lens solution. Bacteria can also accumulate in the solution as well, multi-purpose solution. So if you do get one, it's better to just start with a clean slate. I recommend throwing away everything, discontinuing contact lens wear. Making sure to definitely wash your hands is also very important while inserting and removing your contact lens as well. Not keeping your eyelids clean is often a culprit of people who get styes. So of course, we have bacteria on our skins. If it gets stuck in the eye gland, or infection of the hair follicle can cause a stye. So not keeping your eyelids clean is also can cause a stye. So I often recommend getting We Love Eyes. It's a good eyelid foam cleanser. OcuSoft is also another one, or even Adenova foaming wash can help keep your eyelids clean. Or if you don't, have any of those things, you can also use baby shampoo diluted with water and a warm washcloth. Just keep your eyelids, we pay attention to keeping our face and everything clean, but we tend to neglect our eyelids. So just gently massaging and keeping your eyelids clean is also helpful as well. Using eye makeup. As I mentioned before in my other videos, eye makeup that is contaminated can also be a culprit of styes. If you have what's called blepharitis, which I'll probably do another video for that, discussing that condition, which is pretty much redness and irritation at the base of your eyelashes that are red and swollen. Other conditions are rosacea and seborrheic dermatitis can also be a culprit, or pretty much are risk factors for developing styes. Even diabetes. So diabetes and other medical conditions make people more prone to getting styes as well. So as I mentioned before, previously at the beginning of this video, there's actually two types of styes. The first one is called an external hordeolum. The other one is an internal hordeolum. So let's talk about the difference between the two. Of course, I will search and probably insert pictures of each so you can kind of determine the two, distinguish between the two. However, you can have both of them. You can have an internal and external hordeolum at the same time. So with an external hordeolum, it looks like a pimple. So it's usually when the hair follicle actually gets infected by the bacteria, and it pretty much looks like a pimple on the base of your eyelash where the hair follicle is infected. With an internal hordeolum, the infection is actually inside of your eyelid in an oil producing gland called a meibomian gland. So that's pretty much the difference between the two. So external is more externally, usually it's a hair follicle at the base of your eyelashes. Internal is actually an infection inside your eyelid, more specifically in an oil producing gland, which is called a meibomian gland. So there's a different type of stye as well, which is called a Chalazion. So with the Chalazion, it usually starts off as an internal hordeolum, but what tends to happen is that the bacteria may have went away, but as far as the inflammation is still there, so it causes the gland to still be clogged up. Chalazions are usually more long-standing and they're not painful, whereas the internal external hordeolum are painful. So stye, painful, red, warm to touch, whereas a Chalazion, it could still be very big, but they're usually not painful. So if they do grow, as far as the Chalazion, if they do grow, they can cause blurry vision, because then at that point it can press down on your eyeball, causing things to be blurry. Both can have like a foreign body sensation just because, your eyelids are swollen. So I definitely recommend seeing your optometrist to make the correct diagnosis, because each person is different. Let's get into treatment. So what you can do at home, of course, as I always mentioned before, definitely hand hygiene, making sure your hands are clean before you do any of these methods. But you can get a warm washcloth, make sure it's clean, soak it in some hot warm water, and actually apply it to the affected area, gently massaging and compressing the area as well. The heat from it helps to declog the gland or the infection to cause it to drain, and also provide some relief as well. So you can actually do this 3 to 5 times per day, and up to 10 to 15 minutes at a time. So in order to keep the washcloth warm, actually soaking the washcloth in hot to warm water, not hot to the point where it's burning your skin. Use some common sense, but not to burn your skin, but warm enough to keep the heat in order to help release some of the clogged eye gland. Do not squeeze or pop the stye, okay? Do not squeeze or pop the stye, because it can cause the infection to get worse or cause it to spread to another part of your eyelid, which then another stye or hordeolum can form. So do not squeeze or do not pop the stye. When do you see your optometrist? When the warm compresses do not help and it won't go away, then it'll be time to see your eye care professional. So by the time you see us with the hordeolum, we'll determine whether if it's internal hordeolum, external hordeolum, or a Chalazion. So depending on those three, usually with the stye, we definitely still recommend the warm compresses, but at that point we may have to also prescribe an antibiotic. either orally or topically. So depending on your situation, your eye care professional will determine what will be best for you. As far as the Chalazion, if it's long-standing, it won't go away, or if it keeps coming back, then at that point, either a steroid injected into the Chalazion may be needed to help reduce some of the inflammation. Another thing that may have to happen as well as being referred out to actually have it cut and drained at that point. So definitely, if it doesn't go away with the warm compresses, if the condition worsens, definitely make an appointment to see your local optometrist, and then at that moment they'll determine the best treatment option for you. So with the steroid injection or the surgery, of course, is done and usually in a doctor's office under local anesthesia, and it's usually just a quick outpatient procedure, and then you still may be prescribed some antibiotics as well. I don't recommend using any type of eye makeup or contact lenses until the condition clears up. Definitely, I always recommend a backup pair of glasses if you do need correction in order to see. Definitely the most updated prescription always helps, but no eye makeup, no contact lenses until the condition resolves. And if the condition does not resolve, definitely follow the instructions of your eye care professional. Well, I hope this helps. It seems like you guys are really liking the eye tip videos. I will try to do this more often. All right, so make sure if you do like this video, please like, comment, and subscribe, and I will catch you guys in another one. Peace out, guys. Oh, and I forgot, if you do like this t-shirt, I'll leave the description in the comment box, and I will catch you guys on another one. Have a good day. Bye.